I jump in with the first question? So critics of this bill, including some very conservative critics, say, the healthcare bill, American Healthcare Act, say it's seriously flawed, and it was passed by the House before the Congressional Budget Office had a chance to vet it. So why did you vote for this measure, and why not demand a better finished product first?
So the Congressional Budget Office scored this bill twice. There were additional amendments made as the negotiations continued, and we will see that score. I ran on repealing and replacing Obamacare. I ran on that in 2 races, both in 2014 and in 2016, because I think we need better health care. As I mentioned in that forum with lots of questions, we've seen increases in healthcare costs, increases in premiums, in copays and deductibles. We deserve better health care, particularly in rural communities that are more patient-centered and allows us greater flexibility. So it is the first part of a long legislative process, and as I said, I'm looking forward to working with the Senate to improve the bill, particularly from states' perspective who have expanded Medicaid, to make sure that we're providing the support we need for that population.
Why send a bill that you know is flawed to the Senate, and why vote yes on it in the first place?
Because Obamacare is collapsing. Obamacare is a failure. We're continuing to see prices increase. 1/3 of the counties in this country only have one choice on their exchange. News came out this week that the state of Iowa, for example, out of the 94 counties, 92 have 0 choices on the Obamacare exchanges. That's a problem when you have a law collapsing onto itself and the prices continuing to go up. What I hear from my constituents is they're continuing to seeing high deductibles. So if they have a $10,000 deductible, many of them choose not to seek care because they can't pay for that out of their pocket given their income level. That's of concern to me. We need better choices. Again, we need more patient-centered health care that gives individuals the flexibility to find the health care plan that works best for them. This is moving us in a better direction, and like I have on other bills, I will always work with the Senate to improve legislation before it gets sent back to the House and to the administration.
Why was your vote a good thing for your constituents, for the people you represent?
So one of the first issues when I started running for Congress was concerns about healthcare costs continuing to increase, concerns about the implementation of Obamacare, the cancellations of people's insurance as a result of Obamacare. We need to move in a better direction that will lower healthcare costs, improve quality, and increase access, particularly when it comes to rural communities. So this moves us in that more patient-centered direction. I believe it will lower costs, but it's going to improve the quality. There's much more work to be done when it comes to healthcare. I think we need more transparency in terms of what those actual health care costs are when you go to a doctor's appointment, when you have a procedure at a hospital. Patients need to be able to choose healthcare that works best for them, and I think this moves us in that direction. It also repeals taxes that have increased the cost of healthcare. I'll give you an example. In this district, I represent quite a few medical device manufacturers. One of the pay-fors for the massive Obamacare spending was increasing medical device taxes on our manufacturers. We've repealed that tax. That will help create jobs in this district. So that's just one example.
Congresswoman, the governor debates the benefits to the state. He issued a report that said that more than 1 million New Yorkers will face significant loss of health care under the American with Health Care Act, and a minimum of $6.9 billion would be a cost to the state by 2020. That doesn't sound like it would benefit either the state or the constituents.
Well, I disagree with Governor Cuomo. This isn't the first issue. I think for too long, Albany has made decisions about health care, and they've punted the costs to the counties. One of the big wins, I believe, in this health care bill was forcing those costs back towards Albany. So as you know, our counties are responsible for a significant portion of the Medicaid costs, and that has an impact on my constituents in this district. So I do disagree with the governor on this. I think this moves us in a better direction to lower those costs and address some of the challenges that we've had in our Medicaid program in New York State, where there is waste, fraud, and abuse.
President Trump was surrounded by...
weren't hearing them. Some people I just spoke with said they felt your answers were canned. A lot of people used the word disappointed to describe tonight. Not that the reviews were all bad, but there was a lot of that sentiment that you weren't hearing them. Do you disagree?
A lot of people in this audience I've actually had the opportunity to meet with in my office in small groups. I know individuals are frustrated, and I have said where I stand on this issue in both elections. I talked about the importance of repealing and replacing Obamacare and moving in a better direction. I know after this last election there's an increased activism that we're seeing across the country. I'm very respectful of that, and I know there are certain areas where we're going to disagree, but it's my job to listen, even when they may completely disagree with me on these issues. And I think I did that tonight, just as I've done in the small group meetings and my coffees with your congresswoman that I've done since I've taken office.
President Trump was surrounded almost entirely by white men following his speech celebrating the healthcare vote. Is Congress out of touch with the needs of working women and minorities in regards to healthcare?
So I certainly think we need more women in Congress. I've been saying that going back to when I first ran. It's one of the reasons that I ran for Congress is having a more diverse perspective. I think we need more young people in Congress. So of course we need more diversity when it comes to who represents us. I'm proud to be the youngest woman ever elected to Congress, and I want to increase the number of women who are there. When it comes to that specific meeting, I chose to go back to my office and was taking calls from constituents and actually doing some local media interviews so that my constituents could hear from me directly about the importance of this vote.
If you could talk about your approach to leadership here. I mean, before the vote, people in the North Country, didn't know which way you were leaning. I mean, specifically about things like pre-existing conditions and Medicaid cuts and tax cuts. I guess, why did you approach the vote that way?
When it comes to pre-existing conditions, I have always said that we should provide coverage for individuals with pre-existing conditions. The legislation does not allow an individual to be kicked off health insurance or to be charged more if they have pre-existing conditions. My approach to this was ensuring that our district had a seat at the table. So while I'm only starting my second term in Congress, I was able to co-author the amendment that was passed as part of the final bill that requires members of Congress to not be exempt, to live by the same laws as the rest of us. That's an important common sense amendment, and it got passed unanimously.
I hear
I
that,
co-authored that.
but not saying how you're going to vote beforehand.
Additionally, I negotiated $15 billion for maternity coverage. Again, this is I'm a sophomore member of Congress who does not sit at the committees of jurisdiction, so I played an outsized role in improving the legislation. My job is to make sure that I have an understanding and look at any last-minute changes. And in terms of this bill, there were additional amendments, and my constituents deserve to know that I am going to read that amendment before I cast a vote. And I've said all along where I stood directionally in terms of how I think it should be a multi-year process. We should not stop the Medicaid expansion until 2020, not this year. It needs to have 3 years so that we can ensure the population has the support they need, providing coverage for pre-existing conditions. I had a seat at the table to be a voice for this district and to improve the bill, and I will continue to have a seat at the table, despite the fact that I'm just starting my second term, and I'm proud of that. I also was one of the voices that I co-chair the Centrist Caucus, the Tuesday group, which are more of the moderate voices from many of the Northeast districts, and that venue provided me an opportunity to help shape and again fight for maternity coverage, fight for the common sense McSally amendment that I co-authored to force members to not be exempt.
What's your message to the dozens of protesters out there who are now afraid of losing their health care?
They should not be afraid. Our plan will ensure that they have access to high quality, affordable health care. They have a right to share their viewpoints, and on this issue we disagree, but they have a right to share their viewpoints. That's one of the strengths of our democracy in this country.
Congresswoman, there's been, oh, sorry, go
Can you
ahead.
tell me
You
what the
have-
prospects are for infrastructure funding as part of the president's proposed budget? I know a lot of local government officials are kind of crossing their fingers, hoping it'll go through and make the necessary improvements in their communities.
I think it's a huge priority. In terms of the specific plan, we have not seen that in Congress yet, but I would imagine we will see that before the end of this year. I think it will be a part of the appropriations discussion as we head into the appropriations timeline before we get to September, the next government funding bill, for example. But I think it will happen this year, and certainly there's a huge bipartisan opportunity. I think we may even have the discussion in tandem with tax reform. to bring along that bipartisan support on important issues. But I'm really hopeful when it comes to infrastructure. What I've done is I co-authored a letter with Peter Welch encouraging the President and the administration to include broadband as part of infrastructure. So again, in addition to highways, waterways, sewers, we need to think about 21st century infrastructure as well.
Last question, guys.
Going back to the the ACHA Act, there's been criticism of all House members, regardless of party, that many members did not read the bill before they voted on it. How much of the bill did you read, and how, you know?
I read the entire bill, I read the amendments, and I actually read the bill multiple times. So 100% every single page I've read of the bill. That's my job.
Thanks, guys.
Thank you.
Did you get everything?
Yeah, thank you.
Thanks.
Thank you.
Thanks.
Appreciate it. Thank you for coming.
Yeah.